Over the next 2 weekends, some Michigan workers in the healthcare industry are expected to protest mandates by the health systems they work for to get vaccinated against COVID-19.
And while public health and medical experts have repeatedly said that COVID-19 vaccines protect against infection and help save lives, some are still saying no to the shots. Right now, Michigan's vaccination push is still crawling toward that 70% goal. As of today, 62.5% of eligible residents have armored up.
But the case rate is also up in Michigan, increasing 15% across the state last week. The rate of positive COVID tests has also increased to 2%. That's up 63% from the June 26th low, making the push for vaccines more important than ever.
Many of you may recall what happened in Texas at Houston Methodist Hospital. About 150 workers who refused the vaccine were fired or resigned. And now some Michigan workers expected to take part in protests here say they are preparing to find new employment.
At last check, about 68% of Henry Ford Health employees and contractors have been vaccinated. For Trinity Health Michigan, that number is a little higher at 75%.
Only time will tell how loud the pushback will be as jobs are on the line. Now, according to legal experts and the Equal Employment Opportunity Commission, employers do have the right to mandate the vaccine.
Tonight, 7 Action News reporter Kimberly Craig takes a closer look at vaccine mandates for hospitals and some of those who are pushing back.
The workers we spoke to say they're not trying to make a political statement about refusing to get the COVID-19 vaccine. They say it's about medical choice and it's personal.
I've been a nurse at St. Mary's for 16 years and I'm scared. I have to start now possibly a new adventure if they let me go. I have to start all over.
As an RN at St. Mary Mercy Hospital in Livonia, Candace Rock is with Trinity Health. It's a national Catholic health system in 22 states with 8 hospitals here in Michigan, including St. Joseph Mercy Health. And Trinity is one of the latest health systems to order all of their employees, including contractors, to be vaccinated against COVID-19. But some of their employees say they're pushing back and even planning to protest.
As a nurse, I'm there to look out for the well-being of others. And I don't feel that the COVID vaccine should be mandatory. I don't feel it's safe. It's not FDA approved yet. I feel there's been a lot of deaths and people have had adverse reactions.
Fearing some sort of retaliation before the protest, some Trinity workers asked that we not show their faces or use their names, including this mother of 4, a lab technician who says she's already looking for other work.
It's almost as if we're being coerced to get it. It's either you get this vaccine or now you no longer can provide for your family.
And this clerical worker says she too will be protesting outside St. Joseph Mercy in Ann Arbor later this month.
If they could just get through the trial and then we won't have a problem, most of us taking the vaccine. But we're being coerced right now, so our livelihood is in jeopardy if we don't take this. And that's not right.
Rob Casalou is the president and CEO of Trinity Health Michigan.
The only thing we ask is that they don't do it while they're clocked in at work and that they don't disrupt our ability to give patient care. But if they want to protest peacefully, we support that.
Before any Trinity Health employees protest on July 24th, we're told some Henry Ford Health employees are expected to protest their vaccine mandate this Saturday.
At the end of the day, though, we have established a deadline that would require this as a condition of employment, and that is September 10th.
A Henry Ford spokesperson points out that the person organizing the protest of their staff mandate is not even an employee. The organizer tells me she's doing it for those who fear for their jobs and want a choice on whether to get a vaccine that was approved for emergency use.
Emergency use authorization is just that. It's for emergency use. Now, I have gotten every other vaccine. You want to know why? Because they've gone through all the trials.
It's been the most intensely studied vaccine in the history of vaccines.
And a lot of people are afraid because they're thinking that all the other health facilities are going to mandate it. But I said, well, if I have to, it comes down to it, I won't work in the healthcare industry. If it comes down to it, I'll do something else, you know.
I fully expect that other health systems are going to follow here very shortly with the same mandates.
And we reached out to Michigan Medicine and Beaumont Health, and for now, neither health system has plans to mandate the COVID-19 vaccine. Kimberly Craig, 7 Action News.
All right, thank you so much, Kim. And Bob Riney, who you just saw in Kim's piece, and the head of healthcare operations for the Henry Ford Health System, sent us a statement. It reads in part, quote, We have received widespread support from our patients, team members, and the community for our decision to require the COVID-19 vaccine for team members. At the same time, we acknowledge that uncertainty remains for some and respect the rights of those members of our Henry Ford family, as well as those in our broader communities, to voice their concerns. It goes on to say that vaccination is the absolute way to end this pandemic, and they are deeply committed to working alongside every team member who has concerns or questions.
For more information about your rights as an employer or employee about vaccination mandates, head to WXYZ.com.